All right, this is going to be my United States University abdominal exam. My name is Joe Moore, and so we're going to pretend like we're coming into the room. Knock, knock, knock. Mrs. Moore. My name is Joe Moore. I'm one of the student nurse practitioners here. I'm going to be doing your exam today. Why are you here today?
For an abdominal exam.
All right, I'm going to be doing the abdominal exam for you. Well, why don't you have a lay back here on the table for me. I want you to raise your shirt up to the lower edge of your breast. Just that's fine. We're not going to expose you. All right, first thing we're going to do is do a little bit of inspection. We're going to inspect all four quadrants and around the edges. And we're looking for contour, symmetry. There's rotund, symmetry. She's symmetrical here. There's no scars. There's no obvious hernias or anything like that. And so the skin is pink, warm, and dry to the touch. It looks just fine. So visually on inspection, everything is just fine. We're going to move off from inspection, we're going to go to auscultation. And so I'm going to listen to all four quadrants. We're going to check out bowel sounds. All right, here we go. I'm going to warm this up for you. Bowel sounds approximately every 4 or 5 seconds, really. She's got good bowel sounds, right lower, right upper quadrant. Transverse. Bowel sounds in all four quadrants, left upper and left lower. So bowel sounds are there. The next thing we're going to do is auscultate. We're going to auscultate for bruits. We're going to use the bell. I kind of like to use both. I'm going to start out in the abdominal aorta, slightly superior. I don't know if you can see this on that video, but slightly superior and just a little bit lateral left. That abdominal aorta will be in there. Switch over to the bell, listening for bruits. Okay, no bruits noted. We're going to go down to the renals, we're going to go down to the iliacs, and then we're going to go down to the femorals. Okay, move down to the iliacs. We just left the renals. Inferior and lateral on these iliacs. All right, we're going to come down to the femorals. Get up in there. It's just inside the ASIs. Okay. As far as bruises, there's no bruise noted. There's no bruise noted on that. And so we're going to move over to percuss. We're going to percuss all four quadrants. We're looking for tympany. When we get done percussing the four quadrants, we're going to percuss liver on her right. We're going to check for spleen. Hopefully we won't find anything on spleen. And in a little bit we're going to palpate for that. With percussion on the liver, we're going to look for tympany. And look for when tympany stops, it'll turn dull. That'll be our inferior. That's dull. Well, that'll be our inferior border. What we would do if we had a tape measure and we were in an office, we would be measuring it. We would mark that inferior border. Take your left hand, put it over your breast tissue, thank you. And we'll come down from the top. We'll look for dull from the top. We'll mark that spot. The distance between these, hers visually is around 7 centimeters. So, but we would mark it. Mark it with just a marker, a skin marker, and measure that out. You want that to be around that 7 centimeter mark. If it's too big, possible referral, too small, and so forth. You can find your abnormal findings. We're going to try, and again over here, please. Thank you. All right. We're not able to detect anything over there on the spleen side, and so we're going to move on with our exam. Now we're going to palpate. I'm going to palpate lightly at first. We're going to do the same exact system. Right lower, right upper, left lower. We're going to mildly or lightly palpate any abdominal masses, anything, any patient tenderness, maybe she's showing some sign of pain or anything. If there's any patient discomfort, you can look into it a little bit further. You have any pain?
No.
All right. We're going to go through a little bit of a deep palpation here. A little deeper. All the way around 4 quadrants. All right. Now, go back on top of that aorta. Try to feel for any pulsations. I cannot feel them. That's a good sign. You don't want that. Okay. Everything's within normal limits so far. No palpations over the aorta. No tenderness. Everything within normal limits. Now we're going to palpate the liver. On the right, of course, we're going to see if we can palpate the spleen on the left. Let's try the liver first. I want you to take a breath in and out. There it is. It's the tip of the liver inferior, where it should be. All right, I want you to do the same thing over here. Take a breath in and out. Okay. The spleen cannot be palpated. That would be a normal finding, okay? Now, when we're going to finish our palpation, we're going to come down here to the femoral arteries and the inguinal lymph nodes. We're going to palpate around down there, see if we can see any, see if we can palpate any swollen lymph nodes or anything like that. Now, I would move from side to side on a real table, and I don't want the patient flipping back and forth, but in a real setting, I would move side to side to get a better angle. Now I'm going to go around and I'm going to check the kidneys. We're going to reach around here, relax, lay back down. Just palpate in there. We're looking for that right kidney. Any soreness, any pain?
No.
All right. We're going to do the same over here. Again, I would go to the other side of the table for this, but there it is. So, pain or tenderness?
Nope.
No, okay. So that's our kidney. We looked at them on both sides. We palpated for them and all that. We did the inguinal. We did the inguinal palpated for any kind of pulsations over the abdominal aorta. We've auscultated. Everything has been done. Now I'm going to have her set up off the side of this table, and it really, instead of setting up, I want you to face that way around. She would be at the side of the table, and this camera would be around the other side so that you can see what I'm doing. But for our purposes today, we'll just have to kind of fake it a little bit. All right. I'll come over here to the CVA. Which is here. Come over here, put her hand. Oh, thank you. All right. I'm just going to do this from one side. I'll do both of them from one side. Go over here, it's costovertebral angle. Give it a little thump. Do you have any pain or tenderness?
No.
All right. Put that over, little thump. Do you have any pain or tenderness?
Nope.
All right, that's the costovertebral angle. All right, please have a seat. We're going to discuss breast and vaginal health. This is a female patient. If it was a male patient, we'd be doing prostate and giving them that education. But right now, we're going to do the education for her. And so we're going to reiterate that you need to do monthly breast exams. They need to be roughly at the same time every month, the very best that you can do with that. And you're going to be doing it at home. We're going to give you brochures and education. We'll give demonstrations with one of the females in the office, if that would make her more comfortable on the monthly self breast exam. And then I'm going to reiterate with her that your yearly pap smear is super important. You need to have that done on a regular basis, and you'll be doing that with your OB-GYN, since I do not do OB-GYN. I'm not an OB-GYN, I'm a nurse practitioner, and so that's what we're going to do, at least in the office that I'm at. They're going out to the OB-GYN. And so that's pretty much it. That's my abdominal exam and finished with education. I want to thank you very much for watching this. I appreciate it.